Uganda has struggled with access to sexual reproductive health services. It is only just enough to note that amidst the challenges in accessibility, it has taken the country a long time to achieve some success. The contraceptive prevalence rate has risen from 18% in 2006 to 35% in 2016, with a target being 50% by the end of 2020.
We had also made significant strides around the issue of unmet need for family planning. We had moved from 34 up to around 28, and we had a target by the president, which he even committed during the ICPD 25 in Nairobi, of reducing it to 10% by 2022.
However, as the pandemic rages, more women are unable to access family planning. They face unintended pregnancies and gender-based violence, among other harmful practices.
A relapse and failure to address the above may lead to a rise in maternal and newborn morbidity and mortality.
According to projections by UNFPA, more than 47 million women could lose access to contraception, leading to 7 million unintended pregnancies in the coming months.
Sadi Ngabo is living with a disability which makes it difficult for him to access sexual reproductive health services. This, he says, is even worse during the lockdown.
So imagine you're using a wheelchair. You want to go to a clinic that is very far. So you end up, going in for something that you would not want to do.
After the lockdown was imposed on 31st March, many people could not access many essential services due to public transport restrictions. Health experts are worried about a catastrophic development if sexual reproductive health services do not become more accessible sooner.
So there's a huge gap now where we were kind of like streamlined and moving forward with sexual reproductive health. We are now slowing down and drastically. And I must add, there is a lockdown, yes, and a very much needed lockdown. But then one thing we have to realize is that sex has no lockdown.
We're actually going to have a lot of reversing if we don't integrate sexual reproductive health immediately. The issue is that right now, access to contraceptive has significantly been affected. People who need contraceptive, all the channels that are there have not been prioritizing the COVID-19 response.
A look into many of the pharmacies which were sampled around Kampala and its suburbs shows that these products and services were last sold in March. They predict a bigger problem if the matter is not handled immediately.
If this continues, there's going to be an increase in unwanted pregnancies. That is the honest truth, because young people are having sex left, right, and center, and majority of them are not being protected. So that is one. Two, there'll be a lot of incest.
The woman has to seek sometimes the permission of the man to work, because men are also not now trusting their women to work on food somewhere to access health and reproductive services. So this has made decision making very, very difficult. And as such, it sometimes have increased the risk of mortality and mobility, especially in terms of women. And it's important that with me, 9 months from now, the population of East Africa will be 200 million from 165.
How then can the situation be converted?
The area to prioritize first is to integrate sexual reproductive health messages into the COVID-19. For example, we're saying to people, stay home. But let's add that while you are staying home, make sure that you take care of your sexual reproductive health.
So I think the Ministry of Health should ensure that they provide at least condoms at the LC1 offices, because they are not far away. It's some 10 minutes walk from here, so I can access them. So I feel like if they put the condoms at the LC1 offices, everyone can access them. But then the LC1 officials should okay, they shouldn't be judgmental.
Dr. Joyce Moriku, the Minister for Primary Health Care, has urged couples to labor and seek access to these services.
This is not the time for the young people to get engaged into sexual activities. They're asking for condoms, they're asking for contraceptives. I'm telling them, abstain.
The country representative of United Nations Sexual and Reproductive Health Agency says they understand the urgent need of these services and are working to ensure that they are brought closer to the people.
We've started to work with Safe Border to make available different kind of contraceptives, condoms and others, so that they will be transported. It's not at the level of an app, because as you know, not everyone has access to a smartphone. And outside Kampala, we've started now to actually give fuel vouchers and cash vouchers to the district health officials and the in charge of health centers, especially Health Center 3, so that they have their vehicle that they actually have, but they don't have the fuel, so that the vehicle can go and pick mothers up, take them to the health facility, but also, again, to distribute contraceptives.
The talk is that if the situation is not handled, then a baby boom and a rise in population is expected in the near future. Olivia Komgisha, NTV News.